We are learning more about the Hantavirus outbreak right now from the World Health Organization, continuing to hold a news conference. We brought you portions of that live when it first began. In the last half hour comes as the cruise ship, which is at the center of this outbreak, now back on the move, headed towards the Canary Islands. And this morning, this rare but serious virus is getting some renewed attention. I want to talk a little more about that right now with Dr. Jodie Guest from the Emory Rollins School of Public Health. She is in the Department of Epidemiology. I can't think of anybody better to talk to this morning. Dr. Guest, I've got so many questions for you. It's great to have you on the show. Thank you for your time.
Absolutely. Thank you for having me this morning.
I think I'll just start with what we just heard from the WHO in that commercial break. I mean, literally just 2 minutes ago, this is what they said. This is not COVID. This is not influenza. But does this have the potential to be another COVID-19?
No, it does not. This is not a fast-moving respiratory virus that is really transmissible to other people. There's a very short incubation period for when one person can give it to another. This is the only strain of hantavirus that actually can move person to person, and it's still very rare.
Well, that's a relief to hear you say this will not be another repeat of 2020 and the years beyond. But if this is so easily transmissible between humans, how can you be so sure?
Well, it's actually not easily transmissible between humans. This is the only strain of hantavirus that actually can move person to person, and it is still uncommon. And you're only really contagious to another person that you're in very close contact for a very short period of time when you first develop a fever if you have hantavirus.
Is it airborne, or do I need to be touching this person to transmit it?
You know, we're not totally sure on all of that, but you do need to be in very close proximity. So it's mostly people who are going to be living together or a medical person who's taken care of another person who has it during this very short incubation period are really the people who are at risk.
Which, I mean, I guess it makes sense. We're talking about a cruise ship here. You think about the tight quarters on these. How do you even begin to limit the spread on a cruise ship with 150 people on there and already 8 confirmed cases?
Right. You know, so they are not living in a condition at the moment, and when they're doing everything that they need to stay safe, which means you're staying in your own cabin, you are taking your meals by yourself or the people that you're in your cabin with, and you are exercising and going outside as a solo person. And so they're really working hard to make sure that if there is person-to-person spread on this cruise ship, that they are limiting contact between people. This is exactly what they should be doing.
We've learned within the last 24 hours that a couple of Georgians are actually being monitored right now because they were on that cruise ship. What kind of symptoms come along with the hantavirus?
Right. So there are 2 people in the state of Georgia who did leave the cruise ship with about 20 other people that are across the world. 7 of them, we believe, are in the United States. We're looking for signs that look like the flu. So we're looking for not feeling well and spiking a fever. And again, that's the moment when you're most at risk for spreading it to someone else. At the moment, neither of these people have any symptoms, but they are doing, again, exactly what we would hope for, which is being well monitored and taking care of their health and making sure that they are staying isolated.
How deadly is this virus that we know?
This is the problem with hantavirus. It actually is quite deadly. It has anywhere between a 35 to 55% mortality rate, which is very high. It is an uncommon virus, but when people get it, they do have a high fatality rate.
And why is that? What makes it so deadly? What symptom is the worst?
Well, it gets in your respiratory system, and unfortunately, there is no treatment for hantavirus. So when you get it, we are treating underlying symptoms like your fever and respiratory issues and making sure that people keep their blood pressure up, but it is all supportive care, so we can't actually treat the virus.
Okay, so there are no treatments right now. How do you see this playing out over the next couple weeks and months?
So I think that what we're going to see is very good contact tracing for people who've been on this ship and watching them for anyone who's developing symptoms. Unfortunately, another thing with hantavirus is it does have a very long symptom window when you can develop the symptoms. And so we want to monitor people for up to 45 days after they have been in contact with people who were on that ship. And that is what our health professionals are doing. This is also why being part of the WHO is so incredibly important, because they are the people that are dealing with this and they are providing the most up-to-date information. And we want to make sure we're part of those conversations.
Let me ask you about folks traveling this summer. Maybe they're out camping or hiking or going on a cruise ship. And from what I've read, this hantavirus can initially be gotten through animal droppings and picked up through rat feces. I mean, how should I be thinking about that if I'm going to be traveling this summer?
You know, you need to know where rats and mice are most likely to be. And again, you need to come in contact with their feces or urine in order to have the chance of getting hantavirus. It is not endemic, meaning it is not in most places around the world. And we do not have very many cases of it ever known in the United States. For example, since we've been tracking it in the US, we've only ever seen less than 900 cases of hantavirus. So it's not a common virus. It is, however, more common in Argentina, which is where we believe this outbreak originated.
Okay. I guess I want to circle back to where we first started this interview. You said we don't need to be concerned. It's another COVID-19 like outbreak. But is there anything that we learned from 2020 that we can apply to right now?
Yeah, we learned a lot of things. First, that our science communication needs to be direct. We need to say what we know and what we don't know, and we need to constantly be updating what we know and making sure we get that information out there. That does not mean that what we said yesterday was wrong. It means that we're learning new things in real time, and we should be doing that. That's the science process. Another thing we learned is that we are all connected to each other. And so while it is uncommon for hantavirus to go person to person, this particular strain can do that. And so our connection to each other is incredibly important. And public health surveillance is about trying to find those connections and make sure we keep people safe.
What a time to be there at the Emory Department of Epidemiology studying yet another outbreak, although right now just confined to this cruise ship. Any final thoughts that you'd like to leave us with, Dr. Guest?
You know, we want to keep following this information. It is constantly changing. And again, we want to be transparent about that, but we also don't want people to be alarmed about this. And then lastly, those people who are on the cruise ship and those who have already lost their lives to this, we want to make sure we're keeping them in our thoughts.
Yeah, no doubt. Okay, Dr. Guest from Emory, thank you so much for your time.
Absolutely. Thank you for having me.